My name is Annette Baldwin. I am a licensed professional counselor. I serve as assistant director for Line Up Recovery here at Southeastern. I always like to say that Southeastern Louisiana University was the first university in Louisiana to implement a collegiate recovery program. Unfortunately, we were not the first in the nation. There's actually over 180 collegiate recovery programs nationwide. And there's actually moving into places like Canada and the United Kingdom. So we're excited to see collegiate recovery just like go all over the world. So what is collegiate recovery? Collegiate recovery basically is a campus program which reinforces recovery from eating disorders, substance misuse, or addiction. It ensures that our students don't have to choose between recovery and their education. It also fills the gap. So what we are is long-term, low-intensity support, maybe for those students who have maybe recently or completed a treatment program or moved out of treatment. So it's on-campus support, and it also, you have to think of collegiate recovery as like filling a gap in campus mental health by offering broader, more holistic perspective on mental health, which includes reducing stigma related to substance misuse and highlighting recovery as overall well-being. So why do we have collegiate recovery, or why now? Part of it is we are coming out of, hopefully, an overdose crisis. We understand that punitive approaches do not always work for reducing substance misuse. And we also know nationally our age in higher education, the age group of 18 to 25 are about the highest risk group to start a substance misuse disorder as well. This is like the peak age of onset for substance use disorders, 18 to 25. So we want to maybe assist our students in their trajectory and hopefully moving over to at least low risk or recovery. About 25% of U.S. college students meet the criteria for substance use. So we're not unique. This is national data. The other part of that is 2.3% of undergraduates do identify as in recovery. So we do have a bulk of students whose parents maybe have intervened early, whether it was high school or within their first couple of years of college, and maybe assisted them through treatment. And now they're on our campus as students in recovery. So what's important about collegiate recovery? First of all, we need to, if we look at data or research, the relapse rate for students involved with on-campus support is about 8%, compared to a national rate of relapse, which is 50 to 60%. So when we do, community convenient support where students can access it, we do have a lot of success with that. Our collegiate recovery programs do have typically a higher GPA rate than the campus rate, believe it or not. A lot of our students see recovery as a second chance, so they take their academics very seriously. But collegiate recovery programs also work to provide language of recovery on our college campus, so it reduces stigma and makes going to treatment or seeking treatment more accessible for our students. So who do we serve? We serve students in recovery. We serve students that need early intervention. So students engaged in risky use who need early intervention or harm reduction support. We also support those students who are sober curious. So they are not necessarily in recovery, but they're beginning to really question their use of alcohol and or drugs. We also support those students who might be affected by family or friends' substance misuse, because we do provide support for family and friends. We also support future professionals. So I always tell our students if you're pre-nursing, if you're going to be in teaching, basically if you're going to work with people, you might find that you're also encountering people with addiction. So being able to be exposed to some of the support that we offer in our program may help you work with those individuals in the future. What types of recovery do we see in collegiate recovery programs? 25% is primarily opioid use disorder. 90% is polysubstance, which is, when you're addicted to more than a couple of different kinds of drugs. 90% previously met criteria for severe substance use disorders. So we do have some students with severity, and about 50% of our students are system impacted. So students who have been involved with the criminal justice system in some way. What does collegiate recovery provide on our campus? So our collegiate recovery program was modeled after Mississippi State and Texas Tech. So we do have an application-based program where students apply. We have two different programs. We have 6 months or more, and we have 6 months or less. And the only requirement for 6 months or less is that they do get some kind of services outside of our collegiate recovery program, like counseling, to make sure that they're supported in their early recovery. The students that come into the collegiate recovery program are offered weekly closed seminars. So our only stipulation is that they meet this closed seminar once a week, but also do 2 recovery-related activities every week, which is up to them. I mean, some of our students do 12-step meetings. For some, it's religious. Some students, it might be working out. Then on top of that, we also offer 4 open recovery meetings a week, which anybody can attend, including our students in recovery. We also offer a dedicated space on campus. So we have a pretty convenient space. It's Suite 2409 in the Student Union Annex. So right across from the bookstore, up the stairs, is our recovery space. Very similar to like a veteran's office. I mean, this is a space that our students in recovery can use whenever they need it. We also offer social opportunities in community. So you have to think collegiate recovery is more community than it is clinical. So some of the things that we do is we attend a fall camping retreat every fall with collegiate recovery programs across the Southeast. In North Alabama at Camp Cosby. So for example, last fall we were there with Tulane University, Mississippi State, University of Alabama, Kennesaw State University, University of Georgia, Athens. They bring their students, we bring ours, and it's a great opportunity for our students to network with other students in recovery. Out of our office, we also provide assessment for substance use disorder. We also provide Narcan distribution and Narcan training, as well as how to be an ally to recovery out of our office. We typically do at minimum at least 6 a semester for anybody who's interested in learning how to use Narcan, which is the drug that you use to bring someone back from overdose. And we know fentanyl is an issue. It's very unfortunately close to us with things that happen, and we can have fentanyl-laced drugs, so it is very important to have Narcan. So why is this important for faculty and staff to understand collegiate recovery? What we would like to have a recovery-ready campus, we would like to have a no wrong door policy. So any faculty or staff certainly isn't responsible for someone's recovery. However, we love that our faculty staff would know where to refer a student, no matter where they are in their substance use, to line up collegiate recovery, just so we can be invitational about what our support services are for that student, so they can choose whether to take us up on that. We also welcome warm handoffs. So if a faculty or staff ever wanted to like walk somebody over to our space so they could see our space and we can talk about what we do, that'd be really great. The main thing is this population, the 18 to 25, is kind of weird because it's like they're more likely to carry the diagnosis of substance use disorder, but they're the least likely to seek treatment. So the more times we can give an invitation or let them know what the choices are, the better. So final takeaway is that all of our students matter. Recovery-ready campuses strengthen the entire learning community. They impact things like retention, graduation, campus safety, mental health, and long-term public health outcomes. If you want more information, you can always call me. My number is 985-549-3233. You can email me at recovery@southeastern.edu. If you are interested in just following along, we do things like Instagram, which our address is at Line Up Recovery, or I guess it's X now. It used to be Twitter, at Line Up Recovery. Or you can follow us on Facebook at CRP Southeastern. So thank you so very much. That's all I have about Line Up Recovery.